Americans with different perspectives aren't talking to each other, but here they do. Good evening. I'm Abby Phillip in New York. Let's get right to what America is talking about. Robert F. Kennedy Jr.
Today I nominated him for, I guess, if you like health and if you like people that live a long time, it's the most important position, RFK Jr. Bobby?
He is, in fact, Donald Trump's choice to run the Health and Human Services Department, HHS. It is an absolute monster of a bureaucracy. It administers Medicare and Medicaid and Obamacare. These are programs that cost trillions of dollars and impact tens of millions of Americans. RFK, though, is thin on the kind of experience needed to run a sprawling agency. He is even thinner, though, on real science. RFK Jr. calls his new potential gig a generational opportunity. But stepping back, this is the latest cabinet proclamation that is seemed to designed to own the libs, perhaps more than promoting good government. Some of what RFK Jr. says sounds okay, even decent perhaps. Making the food supply healthier, making policy to promote more exercise, making the government less beholden to big pharma. That's all fine and good. But then there is the stuff that he wants to roll back that doesn't make much sense, like mandatory vaccines in schools. I mean, do you like measles, mumps, rubella, hepatitis, polio? What about chickenpox? No? Well, all of these diseases are diseases that hardly exist thanks to mandatory vaccines and modern medicine. We are joined, though, today at the table by two doctors, Dr. Ian Lipkin, director of the Center for Infection and Immunity at Columbia University, and Dr. Devi Nim. I'm going to butcher her last name here, so I'll let her say it for herself. She's an associate professor of NYU's School of Medicine. Dr. Devi and Dr. Lipkin, I'm going to start with you both because, and Dr. Devi, I'll let you start because you see something in the RFK appointment that you are fine with. Tell us what it is.
Well, I think the first question is, what are we trying to accomplish with healthcare at all, which is to increase life expectancy, and then when you have more years, to have more quality of life within those years. So that goes beyond just vaccines. That involves so many things. Our biggest killers are heart disease, cancer, cardiovascular problems, unintentional injuries, and the biggest barrier for people is really healthcare costs. That there's the direct cost where we have technology like robotics and AI, regenerative medicine, but it's not accessible to people. And then we have other barriers where even the people who might be able to get towards it, where they have insurance, they can't afford co-insurances, deductibles, the indirect costs of transportation, and there's various biases and disparities. So my priority would be, is this person able to do that? And I think he can address some of those things. And part of it is because he expresses a degree of skepticism, which I think we could use. It's been several decades that, we've had poor healthcare outcomes compared to the amount of money that we spend on healthcare. And so maybe we can try doing something differently. I don't think this should be a dictatorship where one person does it, but at least we should try.
Well, I've been tracking his views for a long time. Speaking specifically about vaccines, there is no better bang for your buck than a vaccine. I'm older, I think, than everybody else here at the table. I remember seeing kids with polio. I remember seeing measles and encephalitis. The amount of good that vaccines has done is impossible to overstate. And I think the risks associated with vaccines are vanishingly low. There will always be adverse reactions to any medication or any vaccine or whatever intervention you want to pursue. But if you look on balance and what we save in the way of birth losses, encephalitis, paralysis, death, there's just no question that these are beneficial.
And there's the mixture of I think that the difference between what the two of you is saying is you're talking about the health part of what RFK is talking about, and then you're talking about the vaccines part, which is completely unfounded that he's pushing all this vaccine misinformation. It's hard to separate the two. I just want to play a little bit about what RFK has said about the agencies that make up a big chunk of the healthcare infrastructure in this country, the NIH, the CDC, and the FDC.
Our big priority will be to clean up the public health agencies like CDC, NIH, FDA, and the U.S. Department of Agriculture. Those agencies have become sock puppets for the industries that they're supposed to regulate. President Trump and I are going to replace the corrupt industry-captured officials with honest public servants. We're going to steer resources to meet our nation's biggest health challenge, chronic disease.
These are incredibly, here's the thing, there might be capture, whatever you want to call it, industry capture of these agencies. Those are incredibly broad statements for agencies that are, by and large, focused on keeping Americans safe and are doing that job every single day.
That's right. And against a backdrop of a time when those agencies' work has been politicized, demonized in many cases, against the backdrop of an administration or President Trump saying that he actually wants to clear out nonpartisan public servants and replace them with partisan apparatchiks. So those two things are in tension. And then there's this. Look, if you want to care about regulatory capture, there's any number of different people who could deal with those issues, with regard to chronic illness. But if you want to actually raise life expectancy, I think vaccines do a pretty good job of adjusting that curve upward. And you can't take this a la carte. You picking him is an intentional choice where personnel is policy. And because he's got a long record of being a crank on issues related to vaccines, that takes any of the positive good that you're trying to suggest he might do, which could be done by any number of other people. And instead, you have to own that. You have to own that.
So I think, because you addressed me, I'll just say
Sure.
There's a culture war in this country, right, where most people, I think, are in favor of vaccines, but not every vaccine is the same for every condition. So if there are people that are skeptical, which there seems to be a large percentage, then their concerns should be addressed. I mean, how do we know, like if we just look at something else, Venus and Serena Williams, how do we know that they're great tennis players? Because they've been challenged and they've won. So there's nothing wrong with having the science looked at again and people's skepticism addressed. There's nothing wrong with doing that. This is a country based on a marketplace of ideas. And the more debate and discussion you have. Exactly.
So the scientific method would suggest that vaccines, by and large, work, correct?
Well,
or do you disagree with that as a doctor?
I'm in favor of vaccines. But what I'm saying is that if people have, of course,
But not Bobby Kennedy Jr. isn't. You're here defending him.
I'm defending health care, that I think that a person can still achieve great outcomes even if we disagree about things. I have every day send patients to other specialties. They're in different specialties. They have different views than I do. I don't expect them to see my patient and then say, oh, yeah, everything Dr. Devi said is right. I don't disagree with anything. Just do that. I expect them to add something. And if they have some concern, I expect them to help me to address that before we achieve a bad outcome.
If we're being intellectually honest, there's really no good reason why Bobby Kennedy, RFK Jr., should be HHS secretary. An advisor, a confidant, somebody who talks to the president and advises, but there's no managerial experience in his resume. There's nothing that says he is qualified to do this job that is in charge of the health of all of us, all these different lanes. If he has views and has insights around food sources, around vaccines, then those should be given in advisory roles.
Why?
Because
what were the qualifications of the previous ones?
Well, I think it's important to always remember that you put yourself. Say that again?
What were the management qualifications? Xavier Becerra.
I'm not talking about the previous. I'm looking forward.
But you're calling into question whether he could actually do this job, and I think it's
absolutely. I think America is now, and I think
it's important to discuss it because Xavier Becerra was just a lawyer and a politician with no management experience.
So does two negatives, two wrongs make a right?
Sylvia Burwell was a Walmart lobbyist. Donna Shalala was a university person. Look,
RFK Jr. is a nut.
Okay, so that's different than what you just said. You just said he doesn't possess the requisite managerial experience, but then we get to the real issue here, which is you want to insult the man, which is your right to do because you opposed him in the election. But you, doctor, are raising the issues that he has been raising, and I think they're appropriate questions to raise. I don't know whether he can be confirmed or not. The vaccine stuff at the table is obviously going to be the flashpoint of this hearing. Mm-hmm. But I'll tell you one thing. This whole issue of the CDC and these public health agencies, look, public trust in the health regime in this country is as low as it's ever been.
But why?
It's because of COVID.
Right.
Because of school closures. Because of mask mandates. Because this country was... But let me just finish. Because this country was drugged through a bunch of condescending and heavy-handed mandates that all turned out to be garbage, and that's why it's low, and the questions are valid.
And RFK is the answer to all of that.
Yeah, but dude, RFK helped promote the assault on the CDC that lowered the disinformation that led to more than a million deaths, Scott. More than 1 million deaths in the United States, higher than any other industrialized nation per capita. That's the result of failed policies and the demonization of the conspiracy theories.
Whose policies?
All right,
under the Trump administration.
John, let me let Dr. Lipkin in, because, again, we got experts at the table. Go ahead, Doctor.
So, first of all, the vaccines we're talking about have been tested. We know they have to go through safety testing, they have to go through efficacy testing, and it's only when they get through that final step, that final hurdle, that they're produced and distributed. So it's not something that we need to revisit. I disagree. The other thing I wanted to refer to is the discussion about the NIH and the CDC. These agencies are jewels. They're considered as such by the rest of the world. The National Institutes of Health has given drugs that I would venture to say everybody in this room has taken, and the FDA has approved those. So if we lose those agencies, we're going to have unproven drugs. We're going to have a whole series of problems. You were talking about COVID. I was in China in January of 2020. I saw what it did to that country. I was in China in 2003 for SARS. I've seen outbreaks. I've seen thousands of people die. When we had a vaccine for COVID, the major advantage we hoped initially was that it was going to prevent transmission as well as reduce disease and morbidity, mortality. We found out that it wasn't as effective in reducing transmission as we had hoped, but it definitely reduced morbidity and mortality. And let me just finish one last thing.
Yeah.
It saved people who otherwise couldn't have gotten care for a heart attack or a stroke or anything else, because the hospitals would have been completely overwhelmed.
I'm not suggesting the agency should be done away with.
That is what he was saying.
And I respect your opinion, but they do need to be reformed for the purpose of increasing public trust. We have to restore trust in them.
The issue about the public trust thing is that this is almost like election denialism. You scream that the election was stolen, and then when people believe you, then suddenly you're saying, well, if only there weren't these questions that I made up. Mm-hmm. You cannot just create doubts and then blame the doubts that you created for the skepticism.
The doubts in the public health regime in this country were not made up out of whole cloth. They are fully derivative of what happened to this country during COVID, and the people and the families and the businesses who were devastated by these mandates.
There are economic impacts, and then there are the health impacts that we are talking about here. RFK Jr. is trying to blame vaccines for health impacts based on no science. No science. We can talk about the economic impacts, but let's talk about the health impacts and whether there is truth to that. I don't think there's that evidence.
I'm also a supporter of vaccines. I believe vaccines work, and I think his skepticism of vaccines and some of the statements that he has made are going to be the most problematic things in his nomination. But you cannot separate these. He has raised real concerns that real people have. And by the way, Trump's not hiding the ball here. He campaigned with this guy virtually every day, and the American people said, you know what? Some of this sounds pretty good.
Yeah, Dr. Devi.
Well, I was just going to add, I treat patients every day, and they ask questions, some which I think are higher level, some which, I wonder. But I still have to take those concerns seriously, right? Because there are other people, he represents a large number of people who feel the same way. So it's our job, if we work for the government, to address those concerns and answer them. It's not enough to just say,
what do you think, Dr. Devi? Let me just ask her this, because I'm curious.
Yeah.
One of the things that he's said is that he wants to go after the medical journals, because he thinks that they're colluding with the pharmaceutical companies and researchers all to make Americans sicker.
Well, I think, like I said, there has to be some kind of legitimacy given to certain things. So what happens is a lot of times, in order to get the FDA approvals, pharmaceutical companies do have to fund the studies, because otherwise people don't have the money to do it. Do I think that suddenly makes all drugs worthy of suspicion? No, not at all. We have incredible technology in pharmaceuticals because of all these advances. But at the same time, I think transparency is the only way to really address those concerns. If we just say, oh, no, there's absolutely no connection connection between the two. That's not true. I mean, now most authors have to disclose if they have any financial connections to industry.
And they should.
If anything's been funded. Exactly. So it's not an idea out of nowhere. There is some basis to it, and it has to be addressed.
And he has no experience to come up with this, right? This is like sending a car salesman to go engineer a bridge. Right. He is not a doctor. And we have to put that on the scales.
Is the current HHS secretary?
Scott, you keep going back to if you want to compare
I'm comparing
what's
them
current,
all.
then that's not realistic, right? Then that isn't giving us an administration that you've worked really, really hard and talked well about, and talked about how well they would go forward. This is headed, I mean, this is the clown car has arrived again.
You're still campaigning, Jeff.
No, I'm calling balls
elected.
and strikes,
They got
Scott.
elected.
I'm actually calling balls and strikes.
Can I just add one more thing to the conversation? I mean, as Dr. Devi talked about, people have concerns about not just the medical part of this, but also about the food, the pesticides, everything.
Yes.
Interestingly enough, there was another person who many years ago tried to raise concerns about the health of the food that we feed our children and our families. And here's the reception that she received.
When I heard this, I thought, get your damn hands off my fries, lady. If I want to be a fatty and shovel French fries all day long, that is my choice.
We're going to have, the government fining us if we use salt.
Coming up straight ahead, all this talk about the government taking salt away from you because it's so bad for you. But aren't there good things about salt?
I hate the government getting involved and telling me what to eat and not to eat.
Food police.
Do you think the government should regulate the ingredients in the food we eat?
Can't we make our own decision about whether or not we want to salt our food?
All right, an Obama government obesity task force. Does every American family need a dietitian appointed by the government to tell them that this food is going to make you fat and this food is not?
Make America healthy again. But that's pretty retro. I mean, Michelle Obama was actually responsibly, to be clear, talking about what we feed our children, what's in our food lunches, whether or not our nutrition standards are up to the modern age, given the obesity rates in this country?
I agree. Before I come back to food, because I think that's very important, I just want to emphasize that RFK Jr. was also pushing a variety of drugs for treatment of COVID, like ivermectin and hydroxychloroquine, that are frankly dangerous and can lead to arrhythmias and heart attacks and other sorts of problems of that sort. Mayor Bloomberg tried to do something to help make foods more palatable, make them safer and so forth for kids in New York City. A child doesn't have the ability to make a decision about whether or not he should be eating French fries or cake or other things. We have to find some way to address this obesity epidemic that leads to hypertension and stroke and cardiovascular disease. We have the same problem with smoking, right? People said you shouldn't take away my right to smoke. But we've done that. And we also need to do similar things with diet.
Yeah. And if that were where this all, the only place that this was, I don't think we would be having this conversation. But to your point, Dr. Lipkin, it's about a lot of other things. I mean, the dangerous lies, I think, are going to be at the federal level at this point. Dr. Devi, Dr. Lipkin, thank you both very much for joining the conversation. Everyone else, stay with me. Coming up next, RFK Jr., he wants to make your food healthier now. Hear how conservatives